Welcome, everyone. Thank you for joining today's webinar entitled Convenience, Maximizing Employee Participation in Your Evidence-Based Wellness Programs. This program is sponsored by WIHA, the Wisconsin Institute for Healthy Aging. My name is Margie Hackbarth. I'm the Director of Business Development for WIHA. By background, I've worked with health systems in Wisconsin for nearly 30 years before joining WIHA this past year. So this is a great opportunity for me to help organizations look further upstream and connect their members with the health promotion programs. With me today is our subject matter expert, Michelle Como. Michelle is the Director of Leader Development for WIHA. She supports leaders, program coordinators, and the trainers in various ways in almost all of WIHA's programs. Michelle's been involved with the Stanford University developed self-management programs for the last 10 years. The contact information for both of us is included with the slide deck, so please add us to your contacts and feel free to reach out to us with questions moving forward. We want to be a resource for you, and our hope is that after today's webinar, you will know us a little better and you will be comfortable contacting us as you work to connect your workers and others with the evidence-based wellness programs. Let's get started. Okay, as we planned today's webinar, we tried to consider the key issues we've received and also the issues at the forefront of employee wellness initiatives in Wisconsin. A common theme with all of our evidence-based programs is self-management and self-efficacy. Michelle is going to explain how both of these are embedded in WIHA's programs, specifically the workplace and the digital programs we are reviewing with you today. For some of our listeners, this is your first introduction to the Wisconsin Institute for Healthy Aging, or WIHA. So just briefly, as a clearinghouse, we also train and develop leaders across the state. For our Stepping On program, we disseminate this falls prevention program nationally. So this means we train and develop leaders across the country. Currently, we have trained leaders in 21 states. Like many of you, WIHA has a goal to bring evidence-based wellness programs to more people, and today we want to talk specifically about bringing these programs to the workplace setting. WIHA achieves our mission by taking programs from research to practice to people. We do this through partnerships, and the 4 categories of partners are listed on this slide in each of the 4 columns. I like to think of this as a 4-legged stool, and without one leg, the stool would not function very well. So each partner category is essential for WIHA to be successful. So we partner with academic researchers, with state and public health aging and policy agencies, and with other community organizations like the Aging and Disability Resource Centers across Wisconsin. We also partner with healthcare and health-related organizations. Many of you on today's call are with the health systems and health plans, so please know that you play an essential role in bringing programs to practice and then to people. Today, we are focusing on bringing the programs to your employees. The advisory board has come out with recommendations regarding wellness programs, and I thought this was a great visual to show the role of community providers. The advisory board is known for its healthcare consultation and industry expertise, and I thought it was noteworthy to point out that the advisory board is recognizing the role of community partners to sustain programs, to support patients, and ultimately to achieve scale. Michelle and I recently heard Dr. Kate Lorig, the researcher who developed the foundation for the programs we are reviewing with you today. Dr. Lorig shared these statistics during a program that was sponsored by the NCOA, the National Council on Aging. She shared that half of all adults have one or more chronic conditions, probably not a surprise to many of you who are listening today. But interestingly, this includes all adults in your workforce, not just older adults. Also, impaired work days are not just absent days, but lower productivity days. So as you well know, your workers may be showing up, but they may not be producing at their best. These are significant costs, and Dr. Lorig shared that these have been estimated at approximately $1,700 per employee per year. So I like to add this is much less than the per participant cost of attending one of the programs that we will be talking to you about today. There's a return on the investment in terms of the costs that are avoided. So what can be done about the high cost of chronic disease? What I would like to do next, I'm going to turn this over to Michelle, who will tell us more about the importance of self-efficacy and self-management, and also introduce us to the new workplace program, Healthy Living, Work, and Home. And then I'll come back and talk about our digital program, Better Choices, Better Health.
Thanks, Margie, and thanks to everyone who's watching today. I'm Michelle Kamel, the Director of Leader Development at the Wisconsin Institute for Healthy Aging, and I'm first going to outline what self-management is as it relates to self-management education programs and how the programs increase participants' self-efficacy or their confidence in managing their health. So if you've ever tried to make a change in your life, maybe it's the typical ones like eating better or moving more, it can feel pretty overwhelming, especially when we're talking about lifestyle changes. Furthermore, many of us already have really full and busy lives, so it could be hard to begin and solidify any new habits. Then add in those financial worries, work stressors, family life, and all those other unexpected obstacles. It can make starting any new goal feel even harder. Now imagine dealing with an ongoing or chronic health condition like arthritis, diabetes, depression. These goals are now long gone because there's all these other things, appointments, barriers to work through first. So simply stated, self-management is all of those things that we do to handle our health and our well-being from day to day. So this chart on the right shows what determines a person's health. And what generally surprises folks is when we look at that lower corner, that clinical care impacts only 20% of our health outcomes. So that's the care that we get from our health professional team, as well as the access to care and the quality of care that we get. The biggest impact on our health comes from those top two slices. Our own individual health behaviors, which is at 30%, and then that social and economic factor, which is at 40%. So our evidence-based health promotion programs fit squarely in that 30% slice, individuals' own health behaviors. Our programs are proven to help people understand and reach goals related to eating healthy and exercise, medication adherence and management, tobacco use, feeling mentally better to handle unexpected challenges, and just an overall feeling of being more in control of their health. Further, when we look at the social and economic factors, these programs help in that slice too. They're connecting community members together, which is a huge social benefit. And then in turn, people are learning about the local resources that will impact and enhance their health in a positive way. Lastly, when a person attends the evidence-based self-management education programs, they become more activated in their health. They're doing more, they're seeing real changes, and they're very excited about it. So they're eager to get personal guidance and seek further health education when the program series concludes. So therefore, there's this huge community clinical link between the programs that WIHA offers and the clinical-based interventions and resources. So in saying all that, to be a good self-manager, individuals may need to increase their self-efficacy. And wouldn't you know, the main goal of self-management education programs is to increase a person's confidence or self-efficacy surrounding their health. So let's talk about some strategies that the self-management education programs, or SME programs, have for long-term behavioral change. There are a handful of key characteristics that these programs have, and bear with me when I attempt to simplify probably an hour-long conversation into one slide. But I think that one of the main components is the program stands firmly in being peer-centered and looking at a person as a whole individual and not just their chronic condition. And then number two is being a 6-week long or a multiple long week program. So it's building a person's long-term habits. And both of these things studies show is increasing a person's self-efficacy or their belief in their ability to make change. So let's zoom in a little bit more on these strategies. So peer-centered learning. People do best when learning from people like themselves. So the leaders or the facilitators of these programs are lay people. And even if they have a health professional background, we ask them to take that hat off at the door, leave their badge at home, and come in just as a person with personal experiences dealing with a chronic condition. And then there's that social benefit again. The leaders and the participants are learning and sharing throughout this program. And this increases a person's belief that they can do it too, because they're hearing about others doing it as well. Uh, and then this also has a powerful impact on where a person doesn't feel so alone in their struggles or their frustrations because they're hearing that other people struggle and are frustrated too around their health condition. So this is a foundational strategy that really permeates throughout the program, but it's also demonstrated in the following categories. So we do have some self-efficacy components here. Learning about a new skill and practicing those skills is one of the self-efficacy pieces because each program has its own toolbox and each session offers uh, information about various tools and skills to use along a person's various needs on their self-management journey. So whether it's a figurative or a literal toolbox, we all know that a tool doesn't work for every job. So this program just introduces and or reminds participants about all those tools at their disposal. And then depending on what their need is in that moment, then you use the correct tool. But then in learning and being reminded about these tools, then they get to practice. And this will be either by themselves or paired up or in a large group. And they get to try out these new tools or skills. And then they may even individually work with this new tool between sessions as a form of practice as well. But it's in this trying and practicing that a person finds out and decides what works best for them. Next is modeling. So leaders are trained to model skills, storytelling, and the use of these new tools and skills to then have participants follow suit. And this is why it's really important that leaders come in as a peer too, rather than in that teacher role. Also, participants are modeling for other participants. You know, it's okay to struggle. It's okay to miss the mark. But then now how are we going to problem solve so we do better next time? Reinterpretation is another self-efficacy component. People act based on what they believe about their illness. Therefore, by helping people expand their beliefs and then modify or reinterpret their symptoms, they can really begin to try new things to relieve or resolve problems. So in this workshop, we talk a lot about their symptoms, but then we dive deeper to look at the cause. What is causing this to happen? Which then will open up possibilities for solutions. So for example, if I'm always feeling frustrated or angry, well, why is that? Well, it's because I can't do the things I used to do. Okay, like what? Maybe it's gardening or eating the same way. Sure, that's really fair. So now let's focus on what we can do surrounding gardening or meal planning. So it really comes out of being a solution based to the emotions that we are feeling or the issues that we're dealing with. Let's look for the cause so then we can work towards a solution. And then last is persuasion. And I like to think of this as positive peer pressure. So if a person is coming to the workshop and they really don't feel like participating or they're not sharing very much, but then they're seeing this camaraderie being built, they may be persuaded to add in their 2 cents at the next session. Or hearing a fellow participant's great experiences in trying out a new concept like relaxation or journaling or trying a walking routine, I might be then persuaded or inspired by that to try that tool next week, even though I maybe didn't want to try it before. So this is just scratching the surface of a very measured design. When given the structure and support, individuals and people usually make good choices about their health. And in this workshop, we never tell people what to do, but rather we inform them, we guide them, and support the participants. And through this, people are given time to critically think through their decisions and their goals and their actions surrounding their health. And then the result is improved health outcomes. All right, so now that you have an understanding about what's around these programs and why the process is so important, I'll overview the Healthy Living Work and Home program. And this is a high-level evidence-based program for working adults looking for techniques to help balance that work and home life when also dealing with health issues. All right, so I'm going to start with the brass tacks, the essentials, and then move into more details. So this program is an adaptation of the 6-week long, 2.5 hours each session, chronic disease self-management program, locally known as Living Well. And it contains very similar content, but it's rearranged into about 1-hour segments for the workplace. And this program is only used in the workplace setting, and it can't be used in any other settings. The Workplace Chronic Disease Self-Management Program, locally branded as Healthy Living with Work and Home, was developed by Dr. Kate Lorig and Diana Laurent at Stanford University and Dr. Matthew Smith out of the University of Georgia. And then lastly, this is for the workplace wellness. So it's really emphasizing on that work-life balance. All right, so Healthy Living Work and Home is a 6-week workshop that meets twice a week for 6 consecutive weeks for about an hour each session. We like to keep the groups at about 10 to 16 people. It just creates a nice group dynamic of diverse perspectives to learn from, but it's not going to be too large that everyone isn't able to share in the time allotted. And this is a workplace only style workshop being held on the worksite with coworkers, so we really have to take confidentiality seriously. And these workshops are not chronic condition specific, but rather we're focusing on the issues associated with chronic conditions and work through them in a wide variety of ways. Because even if people aren't sharing the same condition, we find that they're often facing the same challenges. And furthermore, in Healthy Living with Work and Home, we don't ask participants to disclose the condition they're dealing with, just the symptoms. And then we focus on those commonalities. And really, how a person participates and what they share is really up to that individual because it's a self-management program, and so it's all about self. These workshops are led by 2 individuals. We call them leaders, or sometimes we say facilitators, and they're trained in this highly scripted and tested material. And then another thing to mention, I mentioned earlier about how leaders are peers. Studies find when professionals lead this program, participants will learn more, but if a peer leads it, participants end up doing more, and the latter is what helps maintain those long-term behavioral changes, along with all those other benefits of having a leader come in straight as a peer. All right, so what do we actually talk about? What's actually done in these workshops? So on this slide, you can see our 6-week, 12-session agenda. And then we also have the textbook in the right corner there, which is used as a reference throughout this series. So to increase a person's ability to self-manage, we talk about many different topics over the course of the program. And then each session has about 1 to 2 learning activities per session, as you can see listed there. The learning activities might be about healthy eating or maybe starting an exercise program, but we also talk about mental health, like dealing with unhelpful thinking or difficult emotions, or maybe depression management and positive thinking and using your mind to manage symptoms and the issues associated. Or it could be weighing those options through making those big decisions and strengthening our problem solving abilities. And then we also talk about strengthening our relationships with good communication skills and learning how to express our feelings or ask for help in an effective way. So while some of these topics may seem basic, being able to take the time to discuss and explore and practice them brings a lot of aha moments for participants. So some additional key elements that are a part of every session are creating and successfully completing an individual action plan, also known as short-term goals. And these goals can be about anything. The typical ones about I want to eat better and exercise more, But then it can also be really mental health driven, like that stack of papers, that junk drawer, reorganizing the house, because that really affects our health as well. But we get really specific on how, really specific and concrete on how we're going to accomplish this. And then when we come back a week later, we'll ask, how did it go? Were you able to accomplish it? Maybe what stood in your way? And then again, help problem solve around any challenges that may come up. So believe it or not, along with all these informational activities and goal settings that's happening, there is still time for group contributions. So there's plenty of storytelling and sharing of experiences and being accountable to one another. And it's really highly effective. As a personal note, if there is certain medical questions that come up, leaders refer participants to their healthcare team. If the content of this workshop conflicts with the instructions that they've already received elsewhere, the person is advised to follow their healthcare provider's orders and discuss any discrepancies with them as soon as possible. Because everyone is different and our leaders are not clinicians. We really want to be rising up this provider patient relationship. So we always tell them that's a great question to ask your provider about. So as with all of our programs, this has real and powerful outcomes. I have plenty of participant testimony from Healthy Living, Work, and Home, but what we really want to hear is the research. So it does have similar research findings to the original Living Well series. Participants have an increase in their self-efficacy and a reduction on healthcare expenditures compared to those who didn't take the program. But further studies show that Healthy Living, Work, and Home participants have a decrease in their physical unhealthy days and a decrease on fatigue and sedentary behaviors, a decrease on their soda intake and fast food intake, and then decrease in their work limitations due to mental demands. And then on the flip side, an increase in the patient-provider relationship in communicating more effectively. And then there were several work sites in Texas and Georgia that stated that the employers who offer this program at their workplace can promote healthy aging among their mid-aged workforce and prevent or delay costly age and disease-related complications and disability, which I think is just great testimony towards this program's benefits and the outcomes. And we really look forward to seeing their one-year follow-up study coming out soon. So I want to thank you for listening to my portion of the presentation today about healthy living, work, and home, and then just the general knowledge around self-efficacy and the self-management programs overall. And we hope to work with you in the future, and I'm going to turn this over to Margie.
Okay, thanks, Michelle. So Better Choices, Better Health is a trademarked name for the digital version of Living Well with Chronic Conditions, the foundational program for the program that Michelle just talked about. It's really been a pleasure and an honor for me at this point in my career to work with Canary Health. They are a nationwide leader in digital therapeutics. I feel like Canary has found that sweet spot between computer expertise and chronic disease self-management expertise. Thus far, they have supported over 65,000 people with their digital program. Okay, a lot of what Michelle just described, self-management, self-efficacy, and the topics within the workshop are very similar between in-person and digital. So I'm not going to go into as much detail about the digital. I did want to talk a little though first about digital therapeutics. It's a relatively new term in the healthcare field. It's in that same digital family as electronic medical records, virtual visits, fitness trackers, medication adherence applications. They're all part of that digital family, but it's different. Digital therapeutics empowers patients, it empowers providers and payers with intelligent and accessible tools to help address a wide range of conditions. And this is done through quality, safe, and effective data-driven interventions. So the intervention that we're talking about today, Better Choices, Better Health, is a digital therapeutics that comes from Canary Health. So as a digital workshop, Better Choices, Better Health differs from the in-person mostly in the areas of convenience. Participants are encouraged to log in at least 3 times a week, and then this is monitored by 2 trained moderators. Similar to the in-person workshop leaders, the moderators pose questions, they support goal setting, and they help participants navigate the program. It is important that anyone who registers for Better Choices, Better Health is eligible to do so. There is a fee, so the participants need to be employees, members, or patients of a hosting organization. And how WIHA operationalizes this is with a business agreement. And then we will check the eligibility of each participant using a function that we call Get Started. So who can benefit from this digital therapeutic program? The variety of chronic conditions is listed here on this slide in the circle on the right-hand side. And the conditions include a variety: diabetes, heart problems, cancer, and others. I'm not going to name all of them. These are just a few. The reason they can all be successful in the same workshop is due to the similar day-to-day problems that the participants experience, similar to the in-person workshop that Michelle talked about. So some of the problems are listed on the left-hand column, and it shows the foundational and the supporting workshop topics. And these were all selected to help support those day-to-day problems that people who have chronic conditions are dealing with. So the workshop curriculum helps participants become better self-managers, and it helps them gain more confidence to address those day-to-day problems that they're experiencing. And these problems could relate to relaxation, pain management, problem solving, sleeping well, many of the topics that are listed on the left-hand column in this slide. So Michelle and I have briefly introduced you to both our workplace and our digital programs. Both have been developed with convenience in mind. This slide shows some of the ways convenience is embedded into both of the workshops, and we feel these convenience factors will better support employees and enhance employee engagement in wellness programs. WIHA understands the steps to engage employees are very different from developing referral systems, for example, for patients. So convenience is a helpful strategy to maximize your worker engagement. Looking at the slide, for Better Choices, Better Health, participants self-tailor the experience for their individual style and needs. Unlike an in-person workshop, they can kind of click around and go back and review something that they want to learn more about. They can also, in the chat area, ask as many questions as they want regarding a specific topic. So if you compare this with an in-person workshop, for example, well, we definitely encourage people to ask questions. We are on the clock, and so we do sometimes need to cut off the questioning. And we also don't always have there's never enough time to go into topics in as much detail as we would like to during an in-person workshop. So the online version just allows for more of that self-tailoring. Convenience, of course, you can do this from a digital program from your sofa, before work, from the cafeteria over lunch hour, or you could do it at the kitchen table after you put your children to bed. So that flexible location and flexible scheduling is really a convenience factor. Transportation barriers may be less of an issue for people who are getting to and from work every day. However, some may rely on public transportation, or some may rely on a carpool, and some may just need other people to give them a ride every day. So having this digital opportunity really supports those who are challenged by transportation. And then anonymity, not everyone wants their colleagues to know the challenges that they face regarding their chronic health conditions. So with the digital version, they can use a fictitious username, and it's only the 2 moderators who know the true identity of the participants. Healthy Living Work and Home Having that on-site convenience, I really don't want to minimize that. That's huge. It saves the travel time for people who may need to travel otherwise to a community wellness program. So that's an added convenience. And sometimes that's just enough to tip the scale and encourage someone who may have been on the fence about participating in a wellness program to do it. So big convenience there. Flexible timing, WIHA is willing to work with you to complement your scheduling needs and make certain that the program is offered at a time that fits with your preferences. And then peer-centered learning. Michelle talked about this with the chronic disease self-management programs. This is an essential part. And if you think about it with our workplace programs, the peer-centered learning is happening with colleagues. So that's an opportunity to really reinforce the message in the workplace before and after the workshops. And then also it supports ongoing maintenance and adherence to the topic information that's shared. So we think this is an added convenience factor that you're learning with people you're pretty close to, and there are benefits to this as well. Any one of these factors on this slide could help trigger upward movement on the activation scale for your employees. So the combination of the convenience factors that we're showing you here, we think can be even more powerful and can combine to activate your employees to become better self-managers, to be more informed consumers, and better patients in the healthcare system. Okay, like all of us, employees have busy lives and full platters. We want our programs to require less effort with less difficulty, not only for your employees as consumers, but also for you as coordinators of these programs. So we do require a business agreement to spell out who's responsible for what. And then within the package of deliverables, WIHA can include a quick start toolkit. So some resources that we are offering to help you get started and to help you refer employees into the program more quickly are included in this Quick Start Toolkit. So there are pros and cons to using this, and I'd like to review that with you. However, I just wanted to mention that Quick Start tools are definitely an option if you need to scale up a worker wellness program more quickly. Some of the other wraparound services are also intended to support a smooth implementation with our partner organizations. My contact information is on the next slide, so please reach out to me to learn how we can tailor a business agreement to meet your organization's individual needs. Michelle wanted me to stress the goodwill that comes back to a host organization. This type of feedback comes from actual participant comments. It's great to work for an organization that cares enough about me as a person to offer a workshop like this. Because today's focus is on convenience, I wanted to end on this point. With the new worksite option and the digital options, this added convenience is a great benefit to your people, and our entire WIHA team will do our best to make the implementation as convenient as possible for your wellness coordinators. All right, so thank you for taking the time today to listen to this recorded webinar, and we will be sending a written copy of frequently asked questions along with the recording, and then we would encourage you, please reach out to us. Our contact information is here. Don't hesitate to ask questions, and as we mentioned earlier, please add us to your contacts and just know that we want to be a resource for you as you develop your wellness programs for your workers, for your members, for your patients. Thank you very much.